So, you've got an ultrasound treatment coming up, and you're probably wondering, how do I get the absolute best results? Well, you've come to the right place. We're going to break down the simple but really crucial steps to take before your appointment. Because here's the thing, getting that amazing outcome isn't just about what happens in the treatment room. It's really about setting yourself up for success long before you even walk through the door.
It's so true. What you do in the days and even weeks leading up to your appointment is just as crucial as the treatment itself. Think of it like you're setting the stage for a fantastic result.
So we've laid it all out in a super simple countdown for you. We'll kick things off with why this prep is a big deal, then walk you through the 2-week mark, what happens in the final 48 hours, and of course, what to do on the big day. And we'll wrap up with some essential health info you need to share. Okay, let's dive right in. First up, why does any of this prep work actually matter? Is it really that important for your results and your whole experience? Believe me, these instructions aren't just a bunch of random rules. They are all there for a reason, to make sure your treatment is as effective as possible, to cut down on any potential irritation, and, this is a big one, to seriously reduce swelling and bruising. It's all about making sure you heal up smoothly and quickly. And here it is, your entire prep journey laid out on a simple timeline. It's like a roadmap to your treatment day. As you can see, we've broken it down into these easy-to-follow chunks. So let's jump in at the very beginning, 2 weeks out. All right, the countdown is officially on. We're starting 2 weeks before your appointment. And right now, the main thing to think about is your skin and the sun. First things first, it is absolutely crucial to stay out of the sun and away from tanning beds for at least 1 to 2 weeks before your treatment. Here's why. Sunburnt or even recently tanned skin is way more sensitive. That can mess with how well the procedure works and definitely cranks up the risk for irritation. Okay, fast forward to the 1-week mark. A few more things kick in here. You'll want to hit pause on any blood-thinning meds like aspirin or ibuprofen, and also some supplements like vitamin E. You'll also want to hold off on any other skin treatments, like facials, peels, or waxing. Now, and this is super, super important, always talk to a doctor before you stop taking any medication they've prescribed. This whole step is really key to keeping bruising at a minimum. Now we're getting really close. And what's cool is that a few tiny adjustments in these final 48 hours can make a huge difference in how you feel and what your results look like. So when you hit that 3 to 5 day window before your appointment, it's time to tweak your skincare routine just a bit. This is when you'll want to stop using any products that have things like retinoids, glycolic acid, or other exfoliants in them. Those ingredients are great, but they can make your skin more sensitive. Pausing them just makes sure your skin is perfectly calm and ready to go. All right, here's a super simple but really powerful swap for the 24 hours leading up to your appointment. On the don't list, alcohol. It can thin your blood and dehydrate you, which can mean more swelling. But on the do list, drink tons of water. Hydrated skin is happy skin, and it just responds so much better to the treatment. And here's another big lifestyle choice to think about, smoking. The recommendation is to avoid it for 24 to 48 hours both before and after the procedure. Why? Well, smoking can really hinder your body's amazing ability to heal itself. So focusing on wellness and hydration is definitely the way to go. And just like that, it's treatment day. Don't worry, this part is super simple and straightforward. So here's your final easy 3-step checklist for the day of. Step 1, keep up with that water. Hydration is still key. Step 2, you need to arrive with a completely clean face. Which brings us right to step 3. That means no makeup, no sunscreen, and no lotions on the area being treated. You want to give your specialist a perfect, clean canvas to work with. Okay, let's wrap up with what is honestly the most important part of your entire preparation, being open and honest with your clinic. This is all about your safety. Look, your safety is, without a doubt, the #1 priority. That's why having a really thorough consultation is so important. You need to share your full medical history, any allergies you have, and every single medication you're taking. This is the foundation for a safe and successful treatment. And it's also really important to ask yourself this question. These treatments generally aren't recommended if you're pregnant or breastfeeding, so it is absolutely critical that you let your clinic know if that's the case for you. And on that same note, if you have any active skin infections, rashes, or even just open wounds in the area that's going to be treated, you have to tell the clinic right away. It's not a big deal. It just might mean your treatment needs to be rescheduled to make sure everything is done safely. This quote really sums it all up perfectly. Following these instructions isn't just about ticking boxes. It's about you playing an active part in making sure your treatment is safe, effective, and gives you the absolute best outcome you can get. So, are you ready to put in a little prep for your best results? After going through all this, you should feel totally confident and prepared for what's ahead. Remember, by following these simple steps, you're not just hoping for a good result, you're helping to create it. Good luck with your treatment.